The first question, if the probe cover does not tear, do I still need to disinfect the probe before the next patient?
The answer to that question, it's an excellent question, is yes, for several reasons. One, multiple studies have shown that probe covers may fail, have inapparent, and I want to say that again, they may have holes or leaks you're not aware of. The way those studies are done looking at probe covers, there are a variety of techniques one can use. One would be if it's something like a condom cover, is just take it off. You can fill it with water, look for small leaks. If it's a more solid material, you can use various methods such as filling the probe cover with electrolyzed water and then using technology looking for ions and others. So probe covers, even though they're not visibly leaking and have holes in them, often will tear or leak. That's the first issue. The second is it is almost impossible to physically remove a probe cover by pulling it off and have 100% assurity you're not contaminating the underlying probe. So if you have even gloved hands and you accidentally touch the probe cover to the probe as it's being removed, or your hands which have touched the probe or have touched the patient's mucous membranes now touch the probe, then you will contaminate it. And again, that's not visible. So one, the probe covers, and I've shown you the evidence, often fail. And two, then when you look at the underlying probe, despite the probe cover, you will find in a substantial number of cases, meaning 15 to 50%, very high numbers, you will find microbes on that probe that clearly are patient-related, not environmental-related. By that, I mean you're finding things such as HPV, Staph aureus, E. coli, Klebsiella, not a simple skin flora that might be in the air, such as coagulase negative staphylococci or other relatively non-virulent organisms. So again, probe covers can never be used with the surety of maintaining the underlying probe pathogen-free. And again, that's why the recommendation is first, thorough cleaning, in part to remove the gel that might be on the probe, but to remove a substantial number of the organisms, and then followed by high-level disinfection, which is giving you 4 to 6 logs of additional removal of organisms. But again, the probe cover does help prevent high-level contamination, and I certainly recommend its use. Again, we want to use a system that is most protective for patients.
Great, thank you. Next question. My manager recently implemented a new automated disinfection system, not just because it was quicker, but rigorously tested against HPV. What evidence do you need to prove a system has been tested against HPV?
That is really an excellent question. So there are several ways to test against HPV. HPV is very difficult to culture. So the most common way of testing is to actually look for HPV DNA, which can be done. And certainly if there's no DNA on the device after cleaning and disinfection, then you have eliminated all the HPV. However, if you do find HPV DNA, it doesn't necessarily mean it's viable HPV, in which case you would have to use you'd have to use a culture technique to find the HPV, which is difficult, but there have been published techniques there. And I should say, when one looks at using some of those HPV culture techniques, there is a literature that suggests that some standard high-level disinfecting chemical agents may be unable to inactivate HPV. So that is an ongoing area of research and concern. The Centers for Disease Control has not specifically stated that agents which have been approved in the United States by the FDA for high-level disinfection, that you need to select agents specifically that studies have shown that inactivate HPV yet. But it is a major concern that there are some studies showing that some of the FDA-approved high-level disinfectants may not completely inactivate HPV. And as I've noted already, UVC light will, with sufficient time and energy, which is built into the UVC device we've discussed, will completely inactivate HPV as they will inactivate all other microorganisms, although they will not necessarily inactivate 100% of the spores at the time that's being used on these devices.
Great. All right, next question. If I clean an HLD and if I clean an HLD the probe and achieve over a 6.5 log reduction, why do I need a probe cover? I get a better image clarity without it and it would save time.
Again, if you're using cleaning and appropriate disinfection, you are over 10 to the sixth, and therefore you would meet the guidelines for a high-level disinfection and would not need a probe cover. Again, it's just professional groups making recommendations, just wanting to have multiple layers of safety so that if in the chance one of your technologists, technicians, or nurses did not adequately clean the object, and therefore now you're only using the high-level disinfection, the probe cover is giving you added protection. It's much like in the same reason in the United States, we build cars that have seatbelts, then they have airbags, and then the car itself is built to, in a high-speed collision, to sort of crumple properly to protect the passengers, because we want redundancy in our system so that if one system doesn't work, for instance, somebody didn't buckle their seatbelt or the airbag failed, you have other systems to protect you. And the same thing is true in medicine. We are risk averse, and we like to build in systems that help prevent any possibility of errors. If there is an error in the processing such that one part of the processing is not done correctly. It's the same reason in the United States, for instance, when we do a blood transfusion, a high risk of substantial patient harm if someone gets the transfused blood that's improperly cross-matched. So in the United States, we have a double check system where two nurses separately have to independently verify that the blood that was sent to the patient is in fact the correct blood type of the patient before it's administered. Just a way of assuring additional assurance of patient safety. And we build this into many things that we do. You know, when we have a patient with MRSA in the United States or another multi-drug resistant organism, all our healthcare personnel in the room will wear gloves. You could argue that if a healthcare personnel performed hand hygiene with soap and water or an alcohol disinfectant and the patient had MRSA, 100% of the time, if they followed hand hygiene, they wouldn't need to wear gloves. We wear gloves to add in that extra level of safety because we know healthcare providers sometimes forget to wash their hands, and so we want redundancy in the system. And that's why we recommend probe covers.
Next question, do you have thoughts on the use of wipes for HLD?
So the concern about wipes for HLD as opposed to another method such as UVC are a number. I've already talked about the fact of redundancy. Here I'll also mention that to the extent possible in medicine, we've always found re-engineering a system is better than trying to educate individuals on how to do something properly. That's why when you look at, say, an automatic endoscope reprocessor for such as an ERCP scope that automatically cleans and disinfects a ERCP or duodenoscope, you find lower risks for contamination as opposed to having a human do all the manual cleaning and the manual chemical disinfection. If they did the cleaning and disinfection 100% of the time, it would work. So the problem with the chemical wipes, the chemical is certainly active if it's a high-level chemical against the pathogens we've mentioned. But the wipe has to be used properly, first of all, meaning it can't be dried out, it can't be past its storage time there. Depending upon the size of the device, like let's say you were using a transesophageal probe, or you have a very long device, you may need to use more than one wipe to cover it there. And most importantly, the chemical must have contact with the pathogen for the correct time period to inactivate it. So you take your chemical wipe and you wipe the probe, and ideally you would also wipe the handle where your hand was, as I've already mentioned that was contaminated. You have to make sure you've touched every single part of the probe. This is, can be difficult because the chemicals are generally clear. You can't see what part of the probe you've touched. You can't really see whether you've missed anything. So yes, when done perfectly properly, you would get 100% safety, but it's very hard to assure all of those other factors, and it's much easier to use a system such as UVC, where you put the device into the machine, you close it, you push a button, and you're assured completely that every part of the probe was reached by the UV light and disinfected. So again, we've engineered here a system that reduces and eliminates any possibility of a human error in not touching every part of the probe with the correct concentration and proper use of the wipe.
Okay, next question. What is the correct method to clean and wipe the probe? Any specific way of cleaning?
So here I cannot give you absolutely a specific guidance on cleaning. I'll give you some general guidance. So you need to look at, for your high-level disinfection method and the exact probe, what the manufacturers recommend for the cleaning method. That is, what type of specific wipe they use, or is it an immersion into water, or is it put into running water? So I can't give you a specific cleaning method. What I can tell you is whatever cleaning method you do use, of course, you want to remove any gel that might be on the probe, any visible contamination, so anything that you visually see, meaning mucus, any dried blood, serum on the probe, any discolored areas, all of those should be cleaned, and so the probe should look as completely clean as possible, as essentially look just like when you purchased it new. And you need to follow the manufacturer's recommendations, both for the disinfection method and the probe, to do that cleaning properly there. Now, I should tell you the difference between cleaning and disinfection, just to be clear here. Cleaning is the physical removal of grime, dirt, and microbes, gels, other things that would interfere with the disinfection method. But it doesn't remove microbes completely, so it does remove a few logs of them, but there are clearly going to be residual microbes left after cleaning. Disinfection then is a chemical or another means. In this case, we've talked about UVC light irradiation for actually killing microbes. So that's the difference between cleaning and disinfection. They're synergistic and additive. They should always be used together to achieve the maximum removal of microbes in order to protect your patients. And this is not specific to endocavity probes, but it's critical for surface disinfection of room surfaces in hospitals, as well as instruments that would be used for surgery. Cleaning always precedes disinfection and sterilization of any reused object. Now, of course, if it's a single-use object, after it had contact with the patient, you're throwing it away, then it needs neither cleaning nor disinfection. You would just discard it, and you need to just make sure it's not improperly reused if it's labeled as a single-use object there. An example of that would be, say, a single-use plastic specular for doing a vaginal examination. After it's used, you would just discard it.
Great. Next question. Well, thank you, Dr. Weber, for the wonderful talk. And her question is, do cancer patients have a higher risk of being infected by HPV from a dirty probe compared to normal patients?
So that's a very good question. I'm not aware of good studies on that. Certainly, patients who had damaged mucosa that would allow easier entry of HPV, inflamed or damaged mucosa, would be at higher risk. But likely, patients who have compromised T cell immunity or antibodies would be infected potentially with a lower dose of HPV than somebody with a healthy rectum or vagina. So the answer undoubtedly is yes. They will be at greater risk of being exposed to HPV, of infection, although I'm not aware of a specific study that's really looked at that risk carefully. But based on everything else we know about acquisition of infections in patients who are immunocompromised that are occurring via the mucous membrane, an example, of course, is SARS-CoV-2, except it's the respiratory system. It's here. If you're immunocompromised, you're one, at greater risk of infection, and two, if infected, you're clearly at greater risk of consequences of that infection. So, as you know, it's well known that if you have infection with HIV and then you become infected with HPV, your risk of then developing an HPV-related cancer is certainly much higher, as it is for other infectious agents that would be acquired via mucous membranes, such as cytomegalovirus or Epstein-Barr virus as well.
Great. And before we wrap up, did you have any final thoughts you'd like to share?
Yes, thank you very much. First of all, I want to thank you all for participating in this talk and for your excellent questions. I know everybody is always busy, so I appreciate your time. And I just want to make the final point again that proper cleaning, high-level disinfection, and proper use of ultrasound probes, as we've mentioned, protects your patients from developing healthcare-associated infections. And certainly, the first rule of medicine is do no harm. We certainly want to use the probes correctly, which we do, to improve patient care using them diagnostically. But we certainly want to protect our patients at the same time. And as I've laid out, that can be done in a relatively straightforward method. Again, thank you for your time. This will be followed, by the way, by a survey at the end that we hope you will all complete.
Thank you so very much, Dr. Weber, for your presentation and for taking the time to answer the questions. And we also thank our audience for attending. And on behalf of Dermatech, Delta Medicines, and Connet, who sponsored the webinar, we would like to thank you for taking the time to join again. And at the end of the session, as Dr. Weber just mentioned, please complete the quiz so a certificate of attendance can be sent to you. Please enjoy the rest of your day.